My name is Dr. Victor Narcisse, and today we're going to talk about the types of diabetes. You may have heard of diabetes, which is when your body is having more difficulty breaking down the food and your blood sugar rises. There are certain cells in your body that absorb the sugar or the glucose in your bloodstream and use it for energy. These cells use it, the sugar, because of the effects of a hormone which we call insulin. Insulin is produced by your pancreas, which is an organ near your stomach. When your body doesn't produce enough insulin or doesn't use that insulin efficiently, it produces diabetes. There are basically two types of diabetes. Type 1 is what we call insulin-dependent diabetes. Patients with this kind of a condition must take insulin regularly or other medications, and this makes up for the insulin that's not produced by your body. This used to be called juvenile diabetes because it was typically diagnosed in children or young adults. However, it is a chronic, lifelong condition that may be diagnosed at any age. If you have a family history of diabetes type 1, you're at greater risk of developing this. The health risks of diabetes type 1 develop when your body's immune system attacks and destroys cells in the pancreas that make insulin. Once these cells are destroyed, the pancreas is no longer able to produce sufficient insulin to do the job of processing the sugar or the glucose in your body, and so this sugar stays in your bloodstream. When there's too much glucose in your bloodstream, particularly for prolonged periods of time, the organs in your body will suffer long-term damage. Type 2 diabetes is the most common form of diabetes in adults. We see this commonly in older patients, but increasingly are seeing them in adults and young people because they're developing diabetes at an alarming rate. We think that this is a family history and is related to the rising rates of obesity in young people. What are the risk factors for developing type 2 diabetes? This type of diabetes can occur when your body develops insulin resistance. So your body makes enough insulin, but can't process it efficiently or effectively. The pancreas, which is where the insulin is made, constantly is told to make more, and eventually loses the capacity to make much insulin at all. This can go undiagnosed for many, many years in an untreated way. But if it is untreated, it can lead to serious medical problems. We worry especially about the cardiovascular diseases that are associated with type 2 diabetes. Type 2 diabetes may be delayed or controlled with appropriate nutrition and exercise. If you've been diagnosed with diabetes, take all the medications that your healthcare provider has prescribed as directed. Additionally, diet and lifestyle changes will be necessary for you to manage your condition and slow its progression. While there is no cure for diabetes, you can manage it very effectively just by learning some simple tips and techniques. You can learn more about the risk factors and what you can do to live the longest healthy life, the precursors to diabetes and insulin resistance. But again, if you don't take the steps, the glucose will continue to build up in your bloodstream, and instead of being used by cells appropriately, it will begin to damage tissues, including your blood vessels, leading to heart attacks and strokes, blindness, kidney disease, and inability of your legs to work correctly. The pancreas is going to try to keep up with the difficulty in insulin production and insulin utilization, but again, gradually the cells fall behind, and the blood sugars continue to rise. When a person has a fasting blood sugar that's too high, we call that hyperglycemia, or there's too much insulin in the blood, hyperinsulinemia, they may have insulin resistance. The health risks of insulin resistance are significant, and the people who have insulin resistance are at greater risk of developing prediabetes, type 2 diabetes, as well as cardiovascular disease. These persons are at greater risk of developing obesity and physical inactivity, and the obesity and physical activity increase your risk of having diabetes. This is the same population of people who are more likely to have cardiovascular risk factors, such as too much bad cholesterol, not enough good cholesterol, high triglycerides, and high blood pressure. That's why it's so important to be aware of diabetes, its risk factors, and to take the appropriate steps to prevent diabetes progression. Even prediabetes, which is a condition that happens before you've met the official criteria of diabetes, but your body is already starting to have trouble with your blood sugar coming down to a healthy range, is something that will increase your risk of type 2 diabetes. So even if you haven't been told by your doctor that you have diabetes or have prediabetes, you should reduce your risk by appropriate nutrition and appropriate exercise. But you'll only know this if you're working with your clinicians to identify it at an early time point. Again, there are things that you can do to prevent the risk of diabetes from causing health outcomes, but you'll have to work with your nutrition, with your exercise, with your clinician to develop the appropriate plan for you. My name is Dr. Victor Narcisse. Good luck.